analysis, of course, provides leaders with a diagnostic overview, and where strengths and pressure points exist within an organization and an ecosystem, these can then be addressed more accurately and more in a more focused approach. Importantly, the goal of the process is not simply just measurement, but as we said earlier, the goal of the process is rather to have actionable insights that will guide strategic decisions about where the organization needs to go, the systems of the organization, and ultimately the culture of the workplace. To illustrate the value of this approach, the next slide highlights some of the types of insights that organizations can uncover through this diagnostic process that we have just discussed. One of the most valuable outcomes of organizational wellness colleagues, organizational wellness diagnostics, is that they reveal patterns that may not necessarily be immediately visible through traditional management metrics as such. When different dimensions of organizational wellness are analyzed together, leaders often begin to see relationships between issues that previously appeared and also that seemed unrelated, therefore clearly diagnosing or identifying the cause and effect of the suboptimal workplace wellness dynamics that often prevail in an organization. For an example, an organization may report relatively strong employee engagement scores, yet still struggle with operational efficiencies or slow decision-making processes. In such cases, the diagnostic may reveal that employees remain committed and motivated. However, organizational systems are creating friction that limits effectiveness. Now, these types of insights are valuable because they help leaders and organizational leadership to identify imbalances within the organization system and therefore act on them more strategically and in a focused manner. Instead of responding to isolated symptoms, leaders are then able to address the underlying systems dynamics that influence organizational performance and trust.